So there's a couple of tips I can share about managing conflict. And many of these tips are going to align with the Crucial Conversations framework, which is a framework that we teach to all of our residents here at the University of Ottawa. And of course, all of our faculty members are encouraged and welcome to take that course as well. But perhaps the first step is figuring out what's going on. Where are you stuck? Often in conflict, we feel emotionally that we're stuck trying to solve a problem, and we need to figure out exactly where we're stuck. Sometimes we're just stuck on one issue, and it's a simple issue, and we can have a conversation about it and solve it. Other times we're stuck because the same issue keeps happening over and over again, and we're frustrated that there's a pattern of behavior that's causing a lot of conflict. And the third level that we're often stuck on is a relationship level, and that's when things have gone so difficult with a person or a program that we no longer feel we can work effectively with them. So the first step is to figure out what level we're stuck. Then we need to figure out where our heart is at. Now, if we want to engage in conflict because we want to win, we want to grind the other person into the ground, we want to punish or humiliate, our heart's not in a good place. And so we need to figure out, what do we really want? What's going to be best for the patient? What's going to be best for their family? What's best for our community? And then we think about other things like what's best for our team, our clinic, our hospital, our university. So we need to get our heart in the right place. So the next part is to think about the stories we tell ourselves. Doctors are like everybody else. We have lots of sensory inputs, and our brain works really hard to make sense out of them. But this is where it becomes essential to know, what are the facts? So what are the things that we saw and observed that are truly factual? And then we can challenge ourselves. Are we making up stories about these facts? Has our brain filled in pieces of information that may not be accurate? Because our brain and our hearts tend not to respond to facts. Our brain and our hearts tend to respond to stories. And if our stories aren't accurate, our whole approach to conflict could be way off base. So we need to scan our stories and make sure we're not, turning ourselves into victims or turning other people into villains or pretending that we're helpless. We need to stick to our facts, think about what's best for everyone, and move forward. Once we've got a firm sense of our story, then we do something very respectful. We ask the other person, what's their story? And we acknowledge, that maybe we've got it wrong, maybe we're missing something. Once we've had a chance to exchange stories, then we get a chance to really get into problem solving. Hopefully we're on the same page, we've both disclosed all of our facts, we've been honest about our feelings, and now it comes time to ask, what are we going to do to make this better? Once the ask is clarified, we need to move into a stage of accountability. And that typically means that the initiator of conflict and the respondent to conflict have some sort of follow-up. In general, I'll recommend that if it's a one-off issue, people should have follow-up on their conflict in about 4 to 6 weeks. If it's an issue that's been a pattern of a concern, then they should probably be meeting every 2 weeks. And they may need to think about having a third party involved if the conflict is particularly difficult to manage. And if their relationship is at risk, that's probably when you need to definitely get third parties involved. You might need to be meeting weekly, and you might need to look at some more forms of external assessment. All of these steps are designed to help people have really useful, practical, respectful styles of conflict that will improve patient care, improve the learning environment, and most importantly, lead to better satisfaction in this wonderful job we call medicine.